presentation on Elevate and using a sexual health and R&J framework to address HIV and AIDS. Today's presentation will be presented by Ms. Valerie Rochester. She's the Director of Programs and Training for the Black Women's Health Imperative. Before we jump into the webinar, I did want to go over a few things with you all and share a few things about the Brown Bag Lunch program. I'm having just a few technical difficulties with my screen, so I'm going to switch out. My apologies. I just need a couple minutes. There we go. So the background, or just a little bit of background about the Brown Bag Lunch program. This is a train-the-trainer webinar, very unique series where participants attend these webinars and then learn tools and things or ways to take back information that you learn on this webinar to be able to implement your own type of training event within your community. So it's not just for individual education, but community education as well. And so on this slide that you see here, kind of just gives a few highlights from the 2014 Brown Bag Lunch program. So it includes a few topics, so around fourth-generational testing, ACA, hepatitis C. We did a report back on USCA, etc. And some of our partners in the past have been HPTN, Project Inform, NASDAD, etc. So just to go over a few housekeeping rules. We are using a webinar service, and if you only are connected to audio through your computer, you may use the chat feature to ask any questions that you may have during the presentation. And then also that's available for others who use the phone to dial in as well. If you have questions throughout the presentation, please enter those there. We do have time set aside towards the end of the presentation to allow you to unmute and for you to give your questions based on the presentation. So now I'll go ahead and introduce our speaker today, Ms. Valerie Rochester. She's a longtime public health professional with over 25 years of experience in providing programmatic, administrative, management, and capacity building training and technical assistance services. As Director of Programs and Training with the Black Women's Health Imperative, she manages the organization's national and community-level health initiatives to address the health inequities that disproportionately impact Black women. So we are very happy to have Ms. Valerie join us on this webinar and very appreciative of the Black Women's Health Imperative. Thank you so much for being here today, and we'll start when you are ready.
Okay, thank you, Denisha. We really appreciate this opportunity to talk about an issue that's really important for the Black Women's Health Imperative. We've been addressing HIV and AIDS issues among Black women for the past 15 years or so, and so always appreciate opportunities to talk about our work and how we address HIV within the context of a sexual health and reproductive justice framework. So that's what the RJ stands for in the title of this presentation. And so a lot of the things I'll be talking about today are discussions around the importance of addressing sexual health and reproductive justice when we talk about effective HIV prevention, and then some recommendations and strategies for how to put that forward, because it really is a structural approach and an organizational approach in addressing HIV. But before talking about that, just to share a little bit of information about the Black Women's Health Imperative, we're an organization that's been around for 31 years. We're based in Washington, D.C., and we have the distinction of being the only national nonprofit organization that focuses solely on the health and wellness of Black women and girls in this country. And with that, we have quite a challenge as far as addressing a wide range of health issues, but also working to ensure that the lives of Black women and Black women's health matters. In fact, that is our theme, Black Women Matter. And so we are committed and dedicated to making sure that we're able to share information, educate women on health issues, and take a policy, health education, and advocacy approach to making sure that the lives of Black women are at the top of legislative agendas, funding agendas, decision-making agendas, and on the life agendas for Black women and girls. Next slide. So when looking at the vision and mission of our organization, again, they all link back to our focus on ensuring that Black women matter. So the vision of our organization, all Black women will enjoy optimal health in a society that promotes health equity and social justice. And the mission is that we advance health equity and social justice for Black women across the lifespan through public policy and advocacy, education, research, and leadership development. And when we look at the health aspect, we focus on a wellness approach, looking at physical, emotional, and financial wellness of Black women and how they all play a part in our overall health and wellness and achieving improved health outcomes for Black women. Next slide. So when we look at all of our work that's related to HIV, AIDS, sexually transmitted infections, and other elements of reproductive health, we always start with a discussion around what is sexual health, because there tends to be some confusion and just lack of clarity around that. And basically, it's commonly believed that being sexually healthy is being free of disease, and that's a small part of it. And so when we do our work, we really focus on ensuring that women understand that sexual health, being sexually healthy, is having a personal awareness and acceptance of our physical bodies and knowing that we have rights to protecting our body and that we have the right to be in healthy, respectful relationships, and we have the right to have those attitudes about our own relationships. So having healthy and respectful attitudes towards sexuality and any relationship we have in our lives, including our sexual relationships. Next slide. And so when we talk about sexual health and being sexually healthy, it's important to identify those barriers that may hinder Black women's ability to be sexually healthy. And so looking at the factors that impact sexual health, there are things like lack of bodily autonomy. There are still many women who don't have control over their own bodies for a number of reasons. They may be in an abusive relationship. They may be forced to engage in sex trafficking. So there are lots of things that impact a lack of ability to take control of our own sexual health and wellness. There are things like cervical cancers and other types of gynecological cancer that impact our sexual health. The presence of HIV and STIs, unintended pregnancies, relationship violence, the impact of trauma, and trauma can come in many forms, as I think we all know, including relationship violence, but it could be forms of trauma from community violence or family violence of some kind, just being exposed to violence. That can bring about trauma in many ways and in many forms that have an impact on our decision-making abilities and could impact our sexual health. High rates of substance use and abuse could be a factor. The lack of access to services, whether they're located in places that don't reach our women, whether they are not gender friendly or culturally appropriate, those can impact our ability to be sexually healthy. And then low levels of health literacy and health insurance literacy. We are all familiar with the Affordable Care Act, but for women who may not have had access to insurance before and are just being able to get insurance under the Affordable Care Act, this is an issue that we're finding is huge. Not really knowing how to use the insurance once they obtain it, not knowing the difference between a copay or a premium. So making sure that we are able to educate women on health literacy is one of the ways that or health insurance literacy is one of the ways we're beginning to address that issue. But again, lacking that information and lacking that knowledge is a key barrier to addressing and improving sexual health. Next slide. So some other barriers to good sexual health, achieving good sexual health for Black women, and these I think we're all familiar with as far as the presence of a wide range of health inequities, health disparities, including poverty, violence, the disproportionate rates of HIV, discrimination in the workplace, in housing, in education, against substance use and abuse. And then there are harmful policies and harmful legislation that limit our access to good reproductive services, like the Hyde Amendment that, of course, does not allow federal funding for contraceptive or abortion services. So these things impact our ability to be healthy and our ability to make good, sound sexual and reproductive health choices. Next slide. There are also social factors that impact our ability to be sexually healthy, and those include, again, discrimination from a racial and gender standpoint, stress. I think we all experience stress in some way, shape, or form in our lives, whether we're students, whether we're in the workforce, whether we're parents, in relationships. There are all types of stresses and stressors that can impact our ability to be healthy overall and impact our sexual health. The media images that we see, a lot of times being depicted as either hypersexual in many cases, and that can impact how we feel about ourselves, or just having those negative images portrayed about us across all forms of media. Negative stereotypes about Black women's sexuality, shame and stigma of possibly having HIV or some other condition that is likely to bring about that stigma in our communities. And then different limitations within the built environment, within the communities in which we live, where again there may be limited access or lack of awareness or again that shame that's associated with living in a particular community as it relates to HIV or some of the issues that impact our ability to effectively protect ourselves from HIV. Next slide. So when we look at these barriers that I've been covering, they really all come together along with several other social and political factors to form this perfect storm. And perfect storm is not positive in any way at all, but we're looking at other things that come into this as well, such as HIV criminalization laws and criminalizing the sexuality of women living with or at risk of HIV. The lack of availability and unequal availability of substance abuse services and treatment options. There's transphobia and homophobia that exists in the community, the high rates of poverty and incarceration in communities of color, and then an overall history of being politically disenfranchised and working to overcome that. There are several movements that have been taking place over the past several years that really are working to overturn that and make sure younger Black women in particular are able to advocate on behalf of their choices and the freedom to make those choices. I think that's something that's being turned around, but it still is a legacy that exists that still presents a barrier for us being able to achieve good sexual health. Next slide. Another barrier that I want to talk about is the impact of trauma. And trauma-informed approaches, which is something I'm going to be covering a little bit later, is usually something that's applied to the substance abuse treatment field, but it has some real implications for HIV as well. And so that's why we've begun to talk about HIV prevention and messaging and education within that trauma-informed framing. And so looking at the impact of trauma and its impact on our ability to be sexually healthy, it can impair sexual decision-making. It impacts our ability to make good, sound decisions about who we choose to have sex with, in what ways, and may cause us to take and make higher risks. That leads to the increase for HIV and other STIs, the increased risk of substance use and abuse across a woman's lifespan, greater risk for poor health outcomes overall. If we're not making good decisions about our sexual health, that's impacting our ability to make good decisions across all elements of our health and wellness. Also leading to high rates of depression and anxiety. There's the presence of post-traumatic stress disorder, the impact of chronic stress, just having to live with guilt and shame and so many other things that can cause stress on our bodies and on our minds. And then for living with HIV, for women living with HIV, can lead to lower T-cell counts and other HIV markers where there would be those poorer health outcomes that we are working to avoid and overcome. Next slide. So when we talk about trauma and how to address that within the work that we're doing, and again, this is an approach that has been applied mainly to substance use and abuse, but there are so many commonalities with that approach that can be applied to HIV. And so again, that's something we're doing as an organization in our HIV work to address sexual and reproductive health and justice issues. So when we talk about a trauma-informed care approach, we're really talking about an organization and every element of that organization reflecting the basic understanding of how trauma affects the lives of women, in this case seeking services, and making sure that any program, any service, any messaging is based on that understanding and understanding the vulnerabilities and triggers that affect trauma survivors, and making sure that programs and services can be more supportive and avoid the risk of re-traumatizing women, even though, of course, it would be inadvertent. It would not be something that would be intentional, but just making sure that all possibilities of re-traumatizing a woman are avoided at all costs. Next slide. So when we talk about trauma-informed care and how we can begin to integrate this into the work we do around HIV prevention, again, we need to realize that it is something that's prevalent. It may not be something that women acknowledge, but many times women may be suffering from trauma and the effects of trauma and not realize it, because again, trauma comes in all forms. So just realizing that it is something that could be a factor in a woman's life, recognizing how it affects all women that may be involved in the program or service that you're providing, and then being able to respond and put this understanding into practice. Next slide. So when we talk about putting it all together, next slide, there are some key things that we want to make sure we're able to consider. When we talk about linking trauma-informed approaches with a reproductive justice framework, for example, we need to make sure that our programming and our work defines, promotes, and maintains the physical, spiritual, mental, and emotional well-being of women. And again, for us, it's for Black women. And that we advocate for recognition among not only the people within our organizations, but with others that we may come in contact in the community as well. We need to advocate for the recognition that genuine reproductive health and rights and reductions in our rates of HIV, STIs, and substance use and abuse are possible only when women have the ability to have power and control over their own bodies. And the impact of trauma greatly affects that ability. Next slide. And when we look at the impact of trauma on the ability to control and manage our own sexual health, we also have to look at a woman's risk factor for engaging in substance abusing behaviors. And we need to expand our education, prevention, and treatment models to incorporate this trauma-informed care approach to make sure that we are able to uncover those issues if they're present and not easily recognized, and then be able to address them once they've been raised and brought to the surface. Next slide. So in looking at sexual health, reproductive health, and reproductive justice, and trauma-informed approaches, all of these things can come together in successful HIV prevention programming. And these are some of the principles that we've identified that are important as far as bringing all of these elements together and making sure we're able to provide well-rounded and reality-grounded approaches. So making sure that in the environment, the language we use, the people that are coming in contact with the women promote an environment of safety. Making sure it's a safe, nurturing environment, non-threatening, making sure women that come in for services don't feel threatened in any way by a staff person or by a perception that may be existing within the organization or within the community about your organization. So everything about the organization and about the work you do promotes a sense of safety. Having trustworthiness and transparency, making sure that all elements of the work are shared and making sure that women feel comfortable and have that sense of trust with the organization, within the program, with other members of the program and participants in the program, and with staff. And if there are any things that may hinder that, or if a woman comes in and feels that she may not be comfortable sharing information, that means there needs to be more transparency within your organization. So it may be something that would need to be looked at. But making sure that a sense and environment of trustworthiness and transparency are apparent every day, in every way, through the work that you do. Collaboration and mutuality, making sure that the work that's being done with clients or women that come in for services are considered true partners in the work. Whether it's prevention, education, whatever. They have a stake in this just as much as we all do as far as providing health education or health HIV treatment services. So making sure there's that common ground and mutual understanding of what the goals are for each woman and working together in partnership with each woman to help her achieve those goals. Making sure that work promotes a sense of empowerment. Here at the Imperative, we never talk about empowering women because we don't feel that we as an organization can empower women. We help women to become empowered. And so that's the language we use, that's the approach that we take. And it's really more affirming for women if we work with them collectively for them to feel empowered and become empowered on their own rather than relying on someone else to do that. So again, promoting a sense of empowerment, making sure women have a voice in what is happening with them as far as programs and services are concerned, and a choice. So making sure we don't limit our choices of programs, services, or opportunities for women to receive the support and the assistance they need. making sure that there's a peer support network that's available for women, and that there are opportunities for them to provide self-help for other women. We have found that to be very affirming for women if they feel that by sharing their story or sharing their experience, they're able to help another woman. So providing those opportunities. Making sure that programs and services are designed from a strengths-based approach. Again, we have found this to be very effective. We don't talk about how sick women are, how poor women are. We focus on where the strengths among black women are and use those points of resilience and those points of strength to design our programming and design our messaging to make sure that this is something that's positive and not, again, coming from a negative standpoint. Making sure that there's inclusiveness and shared purpose for the work. Again, making sure that the women that are part of the program play a part in determining what happens and in maybe leading some sessions, but making sure that the work is as inclusive as possible and that all aspects of culture are represented, whether it's gender-wise, culturally, age, economics, sexual orientation, sexual identification. Again, making sure that there is that inclusiveness across the board. Making sure that cultural, historical, and gender issues are incorporated. First of all, making sure you're aware of them, and then making sure that they're incorporated and addressed throughout all programming. And then all of these things are really ineffective if we don't build in some type of change process, helping women move from one point to another and helping them identify the steps that are best for them to take in order to achieve whatever change they want, whether it's improving some aspect of their health or being able to get a job or being able to reduce their risk for HIV. Making sure that there is some change that's going to be taking place as a result of them being involved in our programming. Next slide. So looking at some of the things that we can do as we begin, again, to put all of these elements together. Next slide. So talking about some of the work that we do and how we put all of this together, we do a lot of work in communities with community-based organizations and partner with these organizations to put into practice the steps that I've been talking about. And in some cases, we work with organizations that do not have HIV as their primary focus. And so we work with those groups to integrate HIV prevention work into what they already do and use that as an opportunity to discuss HIV within a broader context and, again, bring in that sexual health and reproductive justice focus and find that there are so many ways to talk about HIV within a chronic disease prevention program, within an HPV prevention or cervical cancer prevention and education program. So we've really been able to use this framework and using that trauma-informed approach to integrate this work into areas and within organizations that would seem to be pretty unlikely partners for this. And we have found that to be a very effective way of getting more women engaged in discussions around HIV prevention and looking at how it affects overall health and wellness. Next slide. One of our key strategies, once we begin to engage with partner organizations, we're very big on talking and sharing our voices and sharing our messages. And so we use what we call community conversations. We have a series that we call A Room Full of Sisters, and we implement that in different cities across the country and use these conversations to help build awareness and develop key relationships that help to promote our work and our messages. And we've broadened the reach of our partnerships to connect, as I mentioned before, with organizations that don't focus specifically on HIV, and again work with these groups to design programs and messages that help to integrate HIV and sexual wellness into their program priorities. And we've been able to expand our network of organizations that work with us from a small group of, I think, about 5 years ago, to up to 27 organizations in 10 cities across the country. So we really use this personal approach where we use women's voices and women's stories and integrate those elements of sexual reproductive health, reproductive justice, and trauma-informed approaches into these discussions and into the work. And we're working on designing some toolkits and other resource materials that can be used to help scale this work a little bit more, because again, we have really found it to be effective, and we're beginning to get requests for this and to do it more often across the country. Next slide. So when we talk about this work, and going back to the title of this presentation, which is Elevate, and we do have an initiative called Elevate because we're all about elevating the conversation and elevating the work around HIV and using that framework that I've been talking about to help raise it to another level. So some of the key questions we ask when we're engaging in communities with organizations and with women living with or at risk for HIV, we raise these common questions. Are we talking to our partners not only about HIV risk, but about what's happening in our own lives? Do we have those relationships with our partners where we're able to talk openly and honestly with one another? Are we talking to each other about this? Are we sharing our stories? Are we sharing information? Are we asking how maybe our girlfriends or family members are dealing with certain situations? Are we taking advantage of those that are around us in order to learn more and share more around HIV and sexual and reproductive health? Are we engaging in healthy relationships, whether it's with a partner, whether it's with the people we surround ourselves with as far as family and friends are concerned? Do we have healthy relationships with ourselves? Those are some key questions that we ask. And then, are we putting ourselves first? We have found that regardless of age, whether we're talking to women 18 to 24 or women 25 and over, we very seldom put ourselves first, put our health first, put our interests first. And we are the first to say that there's nothing wrong with putting ourselves first. We care about so many others, and we always use the airline approach. If you ever need oxygen, you put the mask on yourself first before you help others. So we make sure that we promote not only addressing those barriers that may impact our sexual health and wellness, but make sure that women know it's okay to put ourselves first and make our own health and wellness a priority and our sexual health and well-being a priority. Next slide. When looking at, again, how we put all of these things together and some of the key steps that we can take, when it comes to developing messages and materials and programming, some of the things that it's good to consider is providing information that supports young women in particular, but all women, in their abilities to have power and control over their own bodies, and provide and support opportunities for women to have a voice and a choice. So making sure there's space made available and time made available if you do group sessions or if you do group programming in some way, making sure that there is time set aside for women to just voice what may be happening in her own life, so that she can express that, release that, and be open to receiving information that can make a change or make a difference in her life. We have found that a lot of times women aren't even ready to hear anything about what kinds of lifestyle changes or steps they can take to reduce their risk or prevent HIV and prevent other types of health conditions, because there's so much else going on in their lives and they need an outlet to release that information and release what's happening. So providing those opportunities for support and for sharing are very important when it comes to effective programming. Next slide. Some other recommendations, it's important to link any type of program or intervention with enhancements in self-concept. A lot of the things I've been talking about really affect women's ability to think positively about themselves, to have a positive self-image or body image. And so working to build in those elements in programming and messaging are important, things that help to promote higher self-worth, higher self-image. We don't talk about self-esteem necessarily, but we talk about self-image, self-love, and body image, and using those as protective factors for helping women to reduce their risk and decide to make lifestyle changes. Support and provide opportunities for individuals to have bodily autonomy, as I mentioned before, and that support self-determination. In some cases, this may not be possible because women may be in abusive situations or relationships, but working gradually to show that this is something that could be achieved, and working in a measured, intentional way to help women understand that they can likely achieve some form of self-determination. So working to support those elements in our programming is important. Addressing the daily realities and lived lives of Black women. That's a term we use a lot. We don't know what's happening when a woman may leave one of our programs and go home, but it's important that we design messages and programming and resources that can address whatever may be happening in their lives and make sure that we can be as responsive and reactive as possible. Offering supportive structures that allow for exploration and expanded thinking on personal issues and experiences. Again, providing those opportunities for women to not only talk about what may be happening in their lives on a personal level, but also letting other women come and share and maybe weigh in on those things as well, because we learn a lot from other women who may have similar experiences. So providing those opportunities to help think a little more broadly and deeply about how an abusive relationship we are in may be affecting our health, or maybe the community in which we live that may have a violent, rates of high violence, how that affects their lives. Looking at, again, the impact of all of these external factors. And then promoting linkages between the individual and larger social forces that affect our lives, socially, politically, and economically. You know, we all talk about the social determinants of health, but making sure we understand how these manifest themselves in the communities where we do our work, and then making sure that as much as possible we're able to include programs and services and elements that help to address some of those. Next slide. So coming to the end of the things that I had scheduled to talk about, again, just want to reinforce that all of these elements that I've been talking about as far as sexual health, reproductive justice, and using a trauma-informed approach all need to come together and can all be basically boiled down to 3 R's: realize, recognize, and respond. So when we're looking at how we can develop those responsive, female-focused, female-centered HIV prevention activities, we need to, again, realize what impact external factors have on our ability to live and be well. Looking at, again, relationships, looking at where we live, where we work, how we play, how all of those things have an impact. Recognize that there are situations that we may not be aware of that happen in a woman's life, but being able to plan for those as much as we can and develop program responses and messaging that takes those things into consideration. And then respond by making sure that our programs, our services are inclusive, making sure that they address a wide range of issues in addition to HIV, but responding in a way that makes it clear that we need to affect the whole woman, that we need to look at programs and services and activities that address the mind, body, and spirit, and address the physical, emotional, and financial wellness of Black women. And in that way, we can ensure that we're doing our best to help ensure that there are effective HIV prevention programs for women that meet these 3 requirements. Next slide.
Thank you so much, Valerie.
All right.
So now we'll take questions from the participants. If you are on the computer, you may enter your question into the chat. If you're on the phone, if you want to raise your hand using the computer, I can unmute your line, and then you can ask your question so that everyone can hear. And so while we're waiting, I did have a question, more so of a comment regarding research. And so this morning, you know, some of you may have seen or may not have seen by now that the results from one of the microbicide studies for women in South Africa, those results have been shared and have been disappointing, and the study failed due to low adherence rates. And so on your slide, when you discuss some of those principles of HIV prevention, it seems like many of those are playing a role on the research end as well. And so do you have anything to share about you know, folks getting involved or in planning groups or things like that to kind of be a part of the planning for research studies to make sure that they are meeting the needs of Black women?
Sure. And the issue and discussion around microbicides is something that has been around for a very long time. I've been doing HIV work for a large number of years, and we were discussing microbicide development back in the mid-90s. So we have yet to have a microbicide that can come to market that would be a true female-controlled element that can, you know, help greatly reduce risk of contracting HIV. So it is important that, you know, we have our voices, and not just our voices, but our representation at the table and in these meetings, in these discussions, on planning groups that make sure that Black women are not disappearing from the discussion around HIV. With prevention dollars and prevention efforts, the focus has shifted again to MSM and MSM of color, and a lot of attention is shifting away from Black women because rates have leveled off. That is one of the rationales behind that, but we are still the highest, fastest growing population among women who are becoming infected with HIV. So the crisis is not over. The sense of urgency is still there. So, you know, doing what we can at a local level in our communities, within our organizations, and also nationally, it's so important to make sure that we do not let people, funders, decision makers, forget that Black women are still represented in this epidemic, and there's still a lot of work to do.
Thank you. Thank you. And so I noticed that Ruby has a question. Ruby, I'm going to unmute your line, so please be prepared to ask your question. And Ruby, I don't think we can hear you. Are there any other questions? And also, I just wanted to give a reminder that the chat box on the bottom right of your screen is also an option. So if you want to type a question there, please do so. All right. And so this is Valerie's contact information. Did you want to kind of go over ways to get in touch with Black Women's Health Imperative?
Sure. Yeah, my direct contact information is there as far as my email address is concerned. And then we have our website, bwhi.org. And then you can also follow us on Twitter and on Facebook.
Great.
And we do have a new initiative that we're launching called My Sister's Keeper that takes all of these elements that I've been talking about, sexual health, reproductive justice, and trauma-informed approaches, and integrating them into programs that we're launching on HBCU campuses around the country. And they're focusing on intimate partner violence, HIV, sexually transmitted infection, and pregnancy prevention, and also community advocacy. So working with college-age women 18 to 24 across the country. So you can go on our website and find out more about that as well.
Thank you. And so we're going to go ahead and wrap up. If some of you, do have questions, please feel free to email myself or Valerie, or you can send your email to Rebecca if you're comfortable that way. I did want to go into a few announcements before I let you all go. So a couple of things I wanted to mention is that if you are planning to do your own local National Women and Girls Awareness Day event, to also utilize the Greater Than AIDS website. There's a toolkit available around Empowered, a DVD video, and things that you can download or order for free online, including posters and buttons as well. Also, I want to encourage you all to read that latest study, the results that were just released about the vaginal gel. And we'll make sure to also send out these links as well as info about Black Women's Health Imperatives, My Sister's Keeper, to you all after this webinar. So as a standard for Brown Bag Lunch webinars, please make sure you take the survey. Let us know what you thought about the information, about the speaker, and then also if you are doing an event utilizing the tools and information from this webinar, please complete and submit your form for a flyer by March 6th. And if you are having an event, if you can submit it earlier than March 6th, that's even better. So my last announcement is regarding the African American HIV University Science and Treatment College. We have now opened the applications for a new cohort, the 2015 cohort. The classes will start in August. If you want more information, please feel free to email me or visit our website, the section on Becoming a Fellow. And then you can retrieve the online application, program and facts, and all that great info. So I just want to lastly thank Valerie so much for joining us today and for presenting on sexual health and ways to address HIV and AIDS. So thank you so much for your time.
Thank you.
And for your presentation. And thank you all for attending the webinar as well. Thank you and goodbye.